Yep, we're all going to get infected with the COVID-19. If it's not going to be the COVID-19, it's going to be the COVID-20, the COVID-21, the COVID-22, the COVID-356, the COVID-887. One way or another, we're gonna get exposed. Let's get over it. Let's accept it, get over it. But don't be scared. Because, using common sense, how are we not going to get exposed to it? Especially if we live in a big city. But stay with me, because I'm going to show you evidence that people are not dying because of the COVID-19 per se. And I'm going to show you evidence of what we really need to do to stop this pandemic. So, it's my humble opinion of what I'm saying. So, first of all, the disclaimer, the famous disclaimer. I'm not a doctor. I'm not a scientist. I'm not an expert. I'm simply a person that's expressing their opinion. What I'm asking you to do is to do your own research. And I'm not claiming for a cure of anything I say, of any disease, or I'm not claiming any prevention. And anything you do, please consult your physician or your general doctor. So, is there hope with what I'm saying? The thing about it is that just like the flu, if you look at it, the flu has been around for millennia, for thousands of years. But, we still need a vaccine every single year. Why? Because it mutates. Every single year it mutates, and they're talking about that the COVID-19 is also going to mutate. So what? Are we going to have to get vaccinated? Which I'm not going to get vaccinated. But are we going to have to get vaccinated every single year because of the difference in the COVID? Are they creating all this fear for control? I want you to ask yourself that question. So, there is hope, but let's talk about the problem. First off, people are not dying because of the COVID. They're dying because of the body's reaction to the COVID. In other words, to my understanding, the pulmonary airways get swollen, get inflamed. They obstruct oxygen to the body, and it's obvious, obstruction to oxygen means death. So, wouldn't it make sense to avoid things that are inflammatory so that we don't get inflamed once we do get exposed to it? Because it's not a matter of if we're going to get exposed to it, but when. But don't be scared. So let's talk some numbers. According to the Worldometer, which the link is below, as of this video, 3.5% of those that acquire the COVID-19 have died so far. And in the US, it's 3.1%. Now, if we take that with the whole world population, which is about 7 billion, that's 0.009% have died of the COVID so far. In the US, it's 0.05%, 0.05% if we take a population of 300 million. So, but wait, is COVID-19 the real pandemic? Let's talk some numbers. They estimate that 15 million of people die per year of heart disease and stroke combined, both together. In the US alone, it's 1 in every 2 will get heart disease in their life. And that's not mentioning 1 in every 3 will get cancer. Okay? So, the other question is COVID the real cause of those deaths I just mentioned? Well, on June 15, a report came out, a journal. I read it in livescience.com, which I'm going to link it below, but there's other sources that talked about it. And I think it was reported by Morbidity and Mortality Journal or something like that. But anyways, you'll see it. It's titled, Why COVID-19 Kills Some People and Spares Others. What they did was they took 1.3 million people that acquired COVID, And what they found is that those with underlying conditions already existing, were sick. Out of all those, they were 6 times more likely to be hospitalized, and hear this, 12 times more likely to die of COVID-19 than those that didn't have underlying conditions. And guess what were the most commonly reported underlying conditions? Heart disease and hypertension, diabetes, and chronic lung disease. The first 2 that I mentioned are diet related, and the third one is both smoking related and diet related. So in general, the risk factors for more severe COVID-19 outcomes in order from greatest to least, according to the study, are age, diabetes, heart disease and hypertension, smoking, your blood type, obesity, and genetics. But let's talk about 2 of them. Let's talk about age and diabetes. So regarding age, 8 of 10 deaths who had COVID, they were all 65 and older. 8 out of 10 were 65 and older. The reason being, it could be because they already have underlying conditions. And obviously the diseases are more advanced at that age because diseases get progressively worse as you age. And obviously their immune system is a little weaker, but it does not have to be that way because there's always ways to boost your immune system, which we'll talk about in just a minute. So, diabetes. Those that were diabetic were 3.7 times more likely to go to critical care than those with no underlying conditions. It's probably due because diabetics tend to have more chronic inflammation, increased coagulation, and immune response impairment. And they also talk about that diabetics tend to produce more cytokines, whatever it's called, which they're known to produce inflammation in the body. Now, another thing about diabetics, they studied 64 people who had type 1 diabetes. Out of those 64 that acquired the COVID-19, 2 died, 25 were hospitalized, and 21 had a condition called diabetic ketoacidosis. Now, guess what average age those 64 people had? 21. 21. What does that tell you? Does that tell you that you die of the COVID-19 or you die because of your underlying conditions? Now, we're going to talk about how those underlying conditions can be prevented or reversed. We're going to talk about that. So for the rest of the factors, read the article yourself down below. So, is there hope? What's a solution? Well, there's many things we can do, but I'm going to talk about 3 things, and I'm going to give you 1 as a bonus. Okay, so number 1, don't overwhelm your immune system. Number 2, avoid habits that cause inflammation in your body, such as smoking and inflammatory foods. And number 3, follow immune boosting habits and avoid immune suppressing habits. And I'll leave number 4 for a little bit. Stay with me. So how do you avoid overwhelming your immune system? Well, it's good to get exposed to pathogens to strengthen your immune system, but you don't want to overwhelm it either. So, obvious things like good hygiene, washing your hands, social distancing, which I don't agree with too much, but, let's not overwhelm the immune system. Because what's going to happen with all this isolation and stuff is that once we start socializing again, which I hope we do, we're going to start getting exposed to all these things all at once, and it's going to overwhelm our immune system. So, at least wash your hands, practice good hygiene. Number 2, So what are the habits that cause inflammation? Well, smoking, which has been known to increase production of cytokines, which I mentioned earlier, inflammatory producing. What are anti-inflammatory foods that don't cause inflammation or that reduce inflammation? Well, according to WebMD, which is linked below, fruits, veggies, whole grains, plant-based proteins like beans and nuts, fresh herbs and spices, and they mention fatty fish, which I don't agree with, but they mention to only eat it twice a week, only because of their omega-3 contents. But you can get omega-3s through flax seeds and hemp seeds and seaweeds and all that stuff. So you don't have to have the fish. What foods cause inflammation? Well, according to WebMD, high fat and processed meats such as hot dogs, butter, whole milk, and cheese, French fries, fried chicken, and other fried foods, sweets, cakes, and cookies, and soda, and gluten. Now, number 3, what are immune boosting habits? Well, again, according to WebMD, link below, good sleep, exercise, immune system boosting foods, reduce stress, not being too isolated, which goes against social distancing, and laughing. And guess what foods are immune boosting according to WebMD? And I'm pretty sure you can find other websites that are going to say exactly the same thing. Fruits and veggies, no meat, and no dairy. WebMD does mention chicken soup if you have a cold or flu, based on a study, but I'm sure a veggie soup would do a lot better. It's probably the hot water that does good to you. And they haven't done a study on a veggie soup. Now, what are the foods that weaken your immune system? Now, according to health.com, which is linked below, alcohol, too much salt and sugar, not eating enough green veggies, too much caffeine, not eating enough fiber, and I quote, it even says, replace fiberless meats with beans or lentils. And now for the bonus. Number 4. If you do acquire the COVID-19, look into hydroxychloroquine along with zinc and azithromycin. I know that there's all this controversy about it, but look into the real science about it. All those studies that are saying that it doesn't work or anything like that, look into it, because what they're doing is that they're giving an overdose, and none of the studies use zinc, which is essential in working into the COVID-19 if you do acquire the disease. But of course, they're going to censor anything that's going to hurt or threaten their pockets. And of course, Big Pharma is going to censor it as well, just like they're censoring all these studies that show that a healthy vegan diet reverses heart disease and reverses cancer. So look into it. Obviously, they don't want us healthy. They want us to keep on asking for and buying, or the insurance buying, all their prescription drugs. So please look into that. Now that's pretty much it. All in a nutshell. You can do your own research yourself. Now let me ask you this question. Why don't we hear all this in mainstream media? I mean, they're focusing on wearing masks, social distancing, hygiene. But ladies and gentlemen, friends and family, your immune system is the most important thing, because it's not going to be the first nor the last pandemic, infectious, whatever that's going to go around. What? Every time there is a pandemic, we're going to shut down the economy? Really? Then we're not going to die of the infection or the pandemic. We're going to die because of hunger and violent crime, because we're not going to have the money to buy any food for our kids, and we're all going to kill each other. Ladies and gentlemen, our best chance is boosting the immune system. But what? Once you acquire whatever you're going to acquire, at that point, you're going to start taking vitamin C, echinacea, and start running like a chicken without a head. By that point, it's too late. You need to start now. Another thing, this whole thing started because of eating animals to begin with. I mean, just like the mad cow disease, the swine flu, E. coli, salmonella, all for eating animal-derived food. Now, let me ask you, why doesn't the government sanction or prohibit distribution of meats and dairy? Why are they prohibiting and trying to push a vaccine that's more than likely not going to work? I mean, do your research. They're not doing the right clinical studies, etc. They're pushing the vaccine. Ask yourself why. They're going to have to kill me to get vaccinated. And if it means not being able to buy food, well, I'll go hungry. I'll go on a hunger strike. So, ladies and gentlemen, I leave you with that. Before, one thing I did want to mention is, if you agree with what I'm saying, share this video, like it, whatever you want. I don't care. I'm not earning any money from doing this. Okay? But if you can refute what I'm saying, comment below, but come with evidence, because I am my own evidence. I've been vegan vegetarian for 14 years. And before I became vegan vegetarian, I was 28 back then, 29, I think. I used to get the common cold once a year, once every 2 years. I would eat a horrible diet. I've never been overweight in my life, but I would eat a horrible diet. Mostly meats, chicken, fish, mostly red meat. And I will get the common cold every single year. But once I became vegan, I never again got sick, with the exception of 3 to 4 years ago. I got a bad cold, but I didn't stop working. I don't know if it was a flu. I never took any medicine. I didn't stop working. I just went with it. But that was the only time I got sick. So I am my own testimony, evidence, whatever you want. And here I am at 43, still ticking. So one thing I do want to mention, which I'm going to start mentioning quite a bit, is about a very horrible pandemic that's going on that has nothing to do with what I just mentioned. And it's the pandemic of human trafficking. I saw numbers that really startled me, and 2 million, they say that 2 million children a year go missing and are, taken for, sexual trafficking and all that. I just want to make people aware of it, more aware of it. We need to get together and stop that. That is a horrible, terrible pandemic that we need to stop. And I think that we all collectively can do it, because, to my understanding, don't take my word for it. I don't know how true it is. A lot of celebrities are involved in that, because as long as they keep paying for that, children pornography and all of that, they're going to keep doing it. So if it means boycotting all those that are involved, boycotting all the celebrities or whatever, let's get together and do it. I don't know how we can stop this, but I just want to go ahead and mention that. With that, I leave you guys. Today is August 13, 2020. I love all you guys. Even whoever's going to contradict me and all the haters, I love you guys too. Don't worry about it. So with that, have yourselves a nice day, and we'll be talking soon. Thank you very much.